Right now with us here, of course, Mohammed Turki, of course, physical therapist. And of course, we are here to ask him some question about what are the role for physical therapists and what are the benefits for us. So can you give us information about physical therapists, please?
Physical therapist is one of the specialty that deal with many cases, especially in the thrombosis team. We are part of the team. Not only a physical therapist, the therapist should have a certified lymphedema therapist therapy in order to issue for the patients the proper stocking or the pressure garment that patient need after he take the proper medication and referred by the the physician. The pressure garment or the stocking that we are talking about is not like a pressure garment that we find in the market. It's have a special gradient of pressure, a pressure gradient, and it's more pressure that give to the patient's skin and vessels. That's pressure that give make sure that the edema or that's come a consequences after the blood clot that happen in the extremity, mainly in the patients. So this pressure garment can make sure that edema that will not appear or reduce it as much as possible. The most difficult cases that come to our clinic is the patients with the severe conditions and progressive swelling. And sometimes we can give a ready-made pressure garment, and that's easy to fit for the patients. But sometimes patients come with severe edema, and sometimes pressure garment with ready-made is difficult, and sometimes we need to make a custom-made for patients. And this process takes a long time. The patient can take his own pressure garment. Regarding the ready-made, usually we'll take first the measurement if we are talking about the lower extremity of the patients and we're having deep venous thrombosis or blood clot in the lower extremity. After patient will take his proper medication like anticoagulant by the physician, we will take the measurement from the ankle and calf muscles and also the thigh. We'll take the measurement for the biggest round measurement, and then we'll see the best size for the patient, and then we'll issue for him. And then after we'll give him the education how he can do donning and doffing, means how he can wear it and take it off. And how he can protect his skin from moisturizing his skin, also plus the exercise that he can do and what he can avoid from what kind of exercise he can do and what other exercise he should leave in order to prevent any complications. We are not taking any measurement for the shoes. Actually, the shoes, the stocking that can be worn as any stocking. The patient can wear any shoes that he like on the stocking itself. So we are not preparing any shoes for the patients, only issuing from a stocking or pressure garment for them. For the patients or anyone in the at home, he feel that any swelling that happened to his or any redness or hotness in his extremity, immediately he should consult a physician to make the proper investigation about his condition, and in order to rule out any complication, rule out any serious issues that patient may need proper intervention and medication to save his life, because there is a lot of consequences of the blood clot. It can happen to the brain or even to the lung, and this is serious condition should be avoided.